All right, everyone, we're going to get beginning in just the next minute or two here. I want to thank everyone for joining us here tonight in person. For those of you that are joining us on Zoom, I also want to send a big thank you to our health officer, John Beagle, who has been instrumental in leading this municipality through the pandemic over the past 2.5 years, as well as everybody on his team, as well as everybody from the county. I know we'll have some introductions in just a minute. So I am going to turn it over to our health officer, John Beagle, and our health educator, Lael Hawani, who's going to do some of the introductions for us right now. And again, thank you all for being here this evening. We really appreciate all the information that I know we're about to receive.
Yeah, thank you, Mayor. And again, thank you, Mayor, Council, for your support over the last 2.5 years. It's been trying times, but we got through it and we're getting through it together. Mayor, I know we've called each other weeknights, evenings, anytime, and some of those conversations were really tough. But again, I thank you for your support, really. It really means a lot. So I would like to introduce the staff that will be presenting tonight. We have Lael Hawani, who is the health educator for the city of Clifton and the township of Little Falls. Kim Finkler. Kim is one of our COVID members. Her specific title is, it's a new title, so I have to remember this, Local Health Outreach Coordinator. We have Adriana Alfaro, who is another local health outreach coordinator. And we're lucky to have Patrick Anderson, the epidemiologist for the Passaic County Health Department. And Patrick has been with us a year now, Patrick?
Yeah, coming on 2 years now.
Okay, so it's been a great asset to us. But before we begin, I just want to also introduce a few people in the audience. Dr. Charlene Gungil just stepped in. She's the county health officer. And I really want to thank Dr. Gungil for the last 2.5 years, your leadership with the testing, the vaccine clinics, everything. Thank you, Charlene. And Araceli Pintley, I think she'll be becoming the new assistant health officer very soon. So welcome. So before we get into COVID and monkeypox, we're just going to talk a little bit about the services that the health department provides for the township of Little Falls. And you could see the, oh, maybe you can't see that, but pretty soon you will see the slide that just basically goes over the services that we provide. Administration, environmental, health education, emergency response, nursing, animal control, and we'll talk a little bit about national accreditation. So as far as administration, each municipality has to have a full-time health officer. So I know shared services over the last few years has been the key word, but health departments have been doing shared services for 50, 60 years. So this is nothing new for health departments doing shared services. Environmental, in environmental, we do restaurant inspections, septic installation, we oversee that. We also do public pool inspections, we do tattoo parlors, and any type of environmental complaints that do come in. We do have our senior registered environmental health specialist that is that comes to Little Falls pretty much every day, whether it be doing inspections or any type of surveillance. Health education, I'll let Lael speak about what she does.
So our health education team is tasked with planning, coordinating, and different programs, clinics, and other strategies to encourage people to make healthy decisions. We do offer a number of programs and clinics, both in the city of Clifton, which we open to Little Falls residents, as well as the township of Little Falls. And really, these programs and clinics they're intended to target babies to seniors. We've done a number of screenings, including cholesterol screenings, blood pressure screenings, cardiac assessments, vein screenings. And like I said, we've offered a number of clinics here in Little Falls Town Hall. We do a number of school programs, dental health, sun safety, hand washing, and more recently vaping. And we've recently brought back a tobacco compliance check program to the township of Little Falls. And then, of course, we offer programming and education through, literature, press releases, and social media.
We also provide emergency response. So anytime there's a restaurant fire or when there was flooding, we assist it with the response of the community. Nursing, communicable disease investigation. So our nurses just don't do COVID investigations. There's a list of numerous communicable diseases that we have to do: hepatitis A, B, C, salmonella, shigella. So all these different types of investigations, our nurses will do that investigation. There's a computer software system. Oh my God.
CDRSS.
Yes, CDRSS. I'm trying to think.
Surveillance system.
Yes, it's a surveillance system that any type of communicable disease from a lab will pop up, and our nurses check that daily to see what type of communicable diseases there are. And then they will follow up with that individual. Some people don't even know they tested positive and we're calling them for the first time. We also do school audits for our schools. We have not done that the last 2 years because of the COVID. We also do vaccination clinics. We do flu clinics. And one thing that we have that a lot of health departments do not have is dental screenings. And we have a dentist on staff that it's really for school-age children, and it's open to Little Falls children. We are definitely thinking, hopefully in a year or so, to open that back up, or half a year, open that back up, and probably to include seniors. And it's free of charge. So that's what we're looking to do. And it'll be open to Clifton and Little Falls residents. Animal control. Animal control is probably one of the toughest jobs you would ever, you ever want to do. We work very closely with the Little Falls Police Department, responding to any type of rabid animal. Sometimes it's a skunk or a raccoon that is acting strange, foaming at the mouth, will respond. We also do some wildlife, but unfortunately, we're limited in what we can do with wildlife and transporting them, et cetera. And the last thing I just want to talk about before getting to COVID is national accreditation. The Clifton Health Department embarked about 4 or 5 years ago on the National Accreditation Trail. We are trying to become the 6th health department in New Jersey to be accredited. We're in the final process. We uploaded 93% of our documents, I believe. And that is over 850 documents that we had to upload for this Public Health Accreditation Board. It just holds you to a higher standard, a gold standard. And that's, what the health department wants to be, a gold standard. So, we talk about COVID. We're going to go take a look back first and what we did, what the county assisted us with, et cetera. And, we have to think back how we were back then, right? We didn't have any vaccines. The testing was poor at best, where somebody would go for a test, you would get the test, 10 days later after the person spread the virus. Now we have some test kits in the back that basically 15 minutes gives you test results. So we have come really far. And I think some people forget about how far we have come. But unfortunately, I think we still have some way to go. So let's just think about that. So these are not everything that we did with the Township of Little Falls, I can tell you that. But these are some of the important dates that we thought that we just wanted to briefly talk about. So in December of 2019, I had a full head of hair at that time, but I pulled it all out, and we noticed on the TV, like a lot of people, that there was something brewing in China, right? So we had conference calls with the CDC, with the New Jersey Department of Health. And so for health departments in New Jersey, we take our guidance from the New Jersey Department of Health. Right? They receive guidance from CDC, but sometimes our guidance in New Jersey Department of Health is not the exact same thing as the CDC, right? So we do not run rogue. We do not make up our own guidelines in the Township of Little Falls, City of Clifton, Passaic County. That's not what we do. We have to go by what the New Jersey Department of Health gives us. So in February, we started to send out correspondence to the Little Falls administration saying, listen, this is really on our radar. We are probably going to have to meet to, discuss different items. So on March 5th, we had our first update with Little Falls administration, department heads and school officials. And that was upstairs. I don't know if you remember that, James, but it was, we were just talking about it. And again, we were just talking, nobody knew exactly what was going to happen, right? We thought it was going to be just maybe a regular seasonal flu and, it'll go away really quick. We didn't know. But we wanted to be prepared. And I think, I always say communication is the key. Communication. It's really good to know who's on the other side of that phone call or that email. It's a good thing to know. And that's the reason why we did that. And on March 9th, our governor declared a state of emergency and a public health emergency. And on the 12th, the city of Clifton received the first case in Passaic County. And it's kind of interesting because that first case, we contact traced it immediately and we knew where the source was, right? We found out exactly how that person, contracted the COVID. And so it was pretty interesting. But, as we went on months and months later, it seemed like everybody was unfortunately getting it.
Just to continue on, March 17, 2020 is when we held our second COVID-19 update meeting here in the same room. Kind of crazy to think that was 2.5 years ago. And then we issued our first statement or press release to the public. And really, the purpose of that was to be as transparent as possible with what was going on at the time. It was precautionary, it was making it clear that COVID was a constantly evolving situation. And just expressing what we knew about COVID at the time, which we knew was going to drastically change as time went on. And as you can see, it was just a few days before our first case actually came in on the 20th. On March 18th, 2020 is when we recorded our first COVID-19 forum. Just so everybody knows, these forums are still accessible on the Clifton Health Department's website. It's on the Health Department page under the coronavirus tab, and you'll actually get to see all 3 that we did right on there. As I said, March 20th was the first COVID-19 case received in the township of Little Falls. The couple days later, March 25th, Passaic County opened up the COVID-19 testing site at William Patterson University. And I'm sure you've either seen the images of the very, very long lines, or you've been on those long lines yourself. It was unbelievable how difficult testing was, to actually come by. So we've definitely come a long way, as John said. And sadly, on April 13th, 2020, we received our first COVID-19 death in the township of Little Falls.
As far as April 22nd, we had our second COVID public forum. And we actually came up with the idea from doing our second meeting here, where we were sitting up here and it was question answer. And I thought that was a really great way to, get some information out. So that's why we did that. So Passaic County, like Lael stated, they did testing at William Patterson for a long time, 3 to 4 days a week. And then they took their show on the road and they went to all the different municipalities, and Little Falls being one of them. We assisted the county and we tested over 180 Little Falls residents at Passaic Valley. So it was a successful day. On July 24th, we met with, in July and August, we met with the Passaic Valley staff, administration, nursing, Little Falls, and I really have to give them a great shout out. The communication and collaboration that Tracy Marinelli from Little Falls Superintendent and the nurses and the Passaic Valley at that time was Dr. Cardillo and now Dr. Healy and their nurses. It was a great thing, our communication. So we did those meetings via Zoom. And then on September 8th, we had a meeting with the entire staff at Passaic Valley, the teachers, custodians on a Zoom, because they were concerned, right? They were going back and we discussed everything that we could at that time. So it was a very successful meeting.
Okay. Just continuing on, September 14th, 2020, the health department offered a meeting again via Zoom to discuss the indoor dining rules and regulations for food establishments. Just kind of going over what those would be, what the recommendations were coming from the state. October 9th, 2020, we held a Little Falls Public Schools Township contact tracing meeting, essentially just going over different scenarios and the best practices for addressing those types of situations. November 24th, 2020, one of many meetings that we had to discuss our mass vaccination plans and efforts. But on this particular day, we actually met with the mayor administration to discuss and just kind of weigh the possibility of offering a weekly clinic at Passaic Valley, in addition to the weekly clinic that we were going to do at Clifton High School. We did have a plan in place. We had that mapped out. However, as time went on, we realized that we were facing such a shortage of the vaccine, and we knew that this would not be an easy feat. And so we made the joint decision not to pursue this particular option. And we knew that there would be, additional clinics opening up nearby. But this particular route, we decided not to pursue. However, with our weekly clinics at Clifton High School, we made sure to, leave spots open for Little Falls residents, Little Falls staff at the schools, administration, et cetera. December 15th, 2020 was when that phase 1A, so consisting of the healthcare workers, the long-term care residents, they became eligible for the COVID-19 vaccine. And on December 19th of 2020, we held an additional forum discussing our mass vaccination plans. And right around the end of December is when, we knew that we were going to be facing a huge challenge with these vaccines, because we started receiving the calls. We were inundated with calls, actually, as I'm sure the county was, with individuals with, extraordinary circumstances needing the vaccine, or their loved ones needing an appointment for the vaccine.
Right. And so in December of 2020, the Clifton Health Department established a hotline for Little Falls and Clifton residents. It was especially used for any questions, but most of the time it was asking for a vaccine. And so we received calls from all over, but we did respond to all the people from Clifton and Little Falls. And it was mainly the people that didn't have the computer skills to make an appointment through the computer system. And that was very important for us, to make sure that everyone was eligible for a vaccine that can get it, whether they know how to use the computer or do not know how to use the computer. So we had hundreds of calls a day. And although we didn't call them back maybe the same day, we called every one of those individuals back just to make sure that they had an answer. January 6th, I know a lot of people had that date for some other reason, but for us, that was our first date that we did our mass vaccination at Clifton High School. We vaccinated almost 300 individuals. We did our vaccination clinic outside. We just felt that was what our decision was. We could not find a place where it had really great ventilation, so we were out there in the cold and wind, but we sustained and we did our vaccinations. And so it was very successful, very rewarding. It was very emotional because people were crying because they were getting the vaccine. And again, we forget about that now, but at that time, it was a very emotional thing. January 7th, we were going by phases. 1B was for law enforcement, and then 1C was the next week, and then basically everybody and anybody was trying to get the vaccine at that point. So we stopped our phases kind of after 1C. And in April, we started doing the homebound vaccinations for individuals that could not get out, and that includes Little Falls residents.
All right, so April 19th of 2021 is when residents 16 and older became eligible for the vaccine. So by this point, there was plenty of vaccine and plenty of other locations that were offering the vaccination. June 7th, 2021, a couple of the staff of the health department provided COVID-19 education and vaccination at the Little Falls Farmers Market. So really with this event, our goal was to maybe reach individuals who had yet to receive the vaccine through more casual, unconventional venues. So with the farmers market, it was like, come purchase some fruits and get your COVID shot. And, fortunately, we did get a few people that day. All right, and we have a nice picture of that in the next few slides. July 1st, 2021, really important time here at the health department where we were able to secure really sufficient grant funding provided by the Department of Health, New Jersey Department of Health, to establish our wonderful COVID team, consisting of 4 amazing and dedicated individuals who we have the pleasure of working with. And they've been instrumental in taking over many of the COVID-19 responsibilities, while also allowing health department staff to try and transition back to our normal day-to-day operations. July 27th, 2021, we held an additional meeting with Little Falls school representatives and school nurses to discuss a safe return to school. Again, just going over various scenarios. And then August 9 and August 10 is when we offered the Pfizer COVID-19 vaccine clinics at PV High School. And also right around this time is when we we ended the operation at Clifton High School, and we moved it to Clifton City Hall. Initially, it was outside to try to keep, everyone as safe as possible. But as the weather, became more inclement, we ended up moving the operation indoors and, tried to set it up in the safest way possible.
Okay, on August 14th, the state and CDC allowed us to offer the third dose for immunocompromised individuals. Again, in August, we had a meeting with Passaic Valley High School, and we also had another clinic at Passaic Valley High School. And we also had at the farmer's market, we had the one, I think it was in end of June that year also, we had a clinic. So, and then in November of 2021, CDC expanded the eligibility for COVID-19 for booster shots. So we did see an increase with that as well. And just before Lael goes on, I just want to compliment the Clifton Health Department staff because, I know a lot of people talk about how great their coworkers are, but these people come to work wanting to make a positive difference in their life, in someone's life. And they do that every day. So you should be really proud to have the services provided by the Clifton Health Department. I could honestly say that. And I could put my head on the pillow every night knowing we did the best job that we could do. Go ahead, Leo.
Thank you, John. So that was it with the, look back. Like I said, that was not, a final list of everything we've done. But those were things that we sort of went through and thought would be important to mention. So in terms of the activities and the priorities of the health department during the pandemic, just wanted to highlight a few of them. Again, as John said, communication was essential. And from the start, we can honestly say that we kept that communication channel open with administration, with the different department heads, school officials, as well as with the public. This level of communication did change over time, and I will elaborate on that in the next few slides. But in terms of a couple of things that we did, we provided the press releases and the case updates. We did very timely and thorough case investigations and contact tracing. We maintained line lists for schools, daycares, and businesses, serving as the liaison between the Township of Little Falls and the State Health Department. And then, of course, our testing and our vaccine initiatives. All right, next slide. So definitely, I think John touched on this before, but I just want to commend our Little Falls partners for helping to facilitate such a strong partnership and constantly being in communication with us, whether it was just to double check on something, double checking on proper protocols, isolation and quarantine guidance, asking questions about the sometimes difficult to understand, executive orders. We definitely appreciated, communication being maintained on both sides. Okay, so case investigations. So for a while, I was the Little Falls girl. When we weren't as inundated with cases in Little Falls, I was the person handling all of the Little Falls cases, making sure I investigated them in a timely manner. Before I go over, some of the information that we gathered, I just want to mention that it was not just the health department staff doing some of these case investigations. We actually trained members of other departments, and then fortunately, especially as things picked back up and things were getting kind of hectic again with COVID, we were provided with those county contact tracers, which were a huge help to the health department. But by doing that, by sort of expanding on the diversity and the variety of staff, we were able to better offer the interviews in different languages. We were able to offer those translation services, which was essential, right, to obtain that information that we might have otherwise not been able to collect. So we early on, we knew we had to be on the same page and consistent with our communication. So early on, we had created a document. I included a screenshot. I know it's difficult to see, but I'll talk about what information was on that document. So essentially, it was a document that was provided to all of our case investigators that included a script that we could all go off of, all of the questions that we were required to ask as, according to the state, and then providing sort of on the side the latest guidance on isolation and quarantine. So ultimately, this was the information we were tasked with collecting, demographic and contact information of the patient, their living situation. For example, were they in a single family home? Were they in a long-term care facility? Were they in an apartment or condo? So this was all important information to obtain, especially to better understand if they were able to safely isolate or quarantine, and of course, who their contacts were. We asked about their hospitalization status, symptom information, and in the beginning, it was that typical fever, cough, shortness of breath, loss of taste and smell. But it was interesting as time went on to see kind of how the virus evolved and some of the other symptoms that people were presenting with. We asked about their exposures, where they believed they were exposed and who they exposed. This was incredibly important. And, we needed to know who these individuals were exposed to so that we could then reach out to their close contacts, talk about quarantine guidelines. Unfortunately, we weren't always supplied with this information, but we did the best we could to express how important it was for us to get this information. We asked about their activity levels. Did they attend work? Did they attend school? Did they attend some sort of event? And of course, you had people tell us that they had not left their house since the pandemic started, which, unfortunately, we sort of have to take their word for it. But we did have people who were very forthcoming, which ultimately helped, prevent possible additional cases. That last bullet point is something I want to stress. We asked questions about whether they needed additional assistance. These were not just cases that we had to interview. They were human beings first and foremost, and we understood that. And so we knew that it was important to not just ask questions about their symptoms and, hospitalization status, et cetera. We knew that it was important to connect people to the resources that they needed to assist with their isolation and quarantine, as well as to actually recover from the illness. With regards to housing, we actually had instances where some of our positive cases were homeless or at risk of being homeless. So we knew that they could not realistically complete their isolation period. So we found ourselves sometimes making calls to hotels, looking for a place that could take them in where they could safely complete their isolation. Before I move on to the next slide, I know I'm spending a little bit of time on this slide. I just want to talk briefly about what it was like as a case investigator and a health department official to speak to these cases, because I don't think a lot of people understand what goes into it. We dial that phone number not knowing what would happen on the other end. Would the person pick up? Would they be willing to answer our questions? Was it the correct individual on the other side of the phone? Unfortunately, there was a time where labs were inundated and had the incorrect contact information listed, which made our lives incredibly difficult. Was the person healthy enough to even answer questions? Were they hospitalized? Were they deceased, God forbid? The most difficult call that I had to make was a Little Falls male who was assigned to me. I dialed the phone number. He did pick up, but I could hear that he was very short of breath. He was having difficulty breathing. And very politely, he asked if we could maybe continue the interview once he was out of the ER, because I had called him when he was in the emergency room for difficulty breathing related to COVID. Very sadly, I was never able to complete that interview because I found out a few days later that he had passed away, which was very difficult to process. Not only were we dealing with this, I had the challenge of calling his wife, who was not only now a widow, was also dealing with a very bad case of COVID herself. And so I can remember that call very clearly. And it was not just, us conducting an interview. It was me listening to her just talk and cry about how wonderful of a man, of a family man, a community member her husband was. And I was just so taken aback by this woman's positivity. And, it had an impact on me. And I just remember hanging up the phone and just totally breaking down. You know, there is no training that can prepare you for this. There is nothing that prepares you for dealing with these types of situations and making these types of calls. You know, we did the best we could, but it came with its challenges for sure. So contact tracing, close contact definition, right, was anybody who spent 15 minutes or more within a 24-hour period who was within 6 feet of a person infected with COVID-19 while they were infectious. So that was 2 days before their onset of symptoms to 10 days after. I did touch on this briefly, but contact tracing became a very important part of what we did, understanding who positive cases had contact with, whether they were household, healthcare workers, schoolmates, work colleagues, et cetera. What that last date of contact was, again, extremely important so that we could determine what the quarantine period would be, what their status was, were they experiencing any symptoms, were they now a positive case? And again, you know, to the best of our ability, we collected that information on close contacts, which was really only as good as what people, you know, our cases were telling us. And then of course, the information regarding the relationship with the case, occupation, the type of contact, et cetera. But ultimately the goal of this was to warn contacts of their exposure if they were not already aware, to determine their symptoms or the risk of developing symptoms and to monitor and follow up with them. And of course, provide guidance as to what their next steps should be in order to minimize the spread of COVID-19. All right, press release, case update. So as of yesterday, the Township of Little Falls had 3,283 COVID-19 cases and unfortunately 23 COVID-19 related deaths. So just a brief note about the press releases. We started this in March of 2020 with the goal of being as transparent as possible. And it continues today. You know, we do offer these press releases, these updates on a smaller scale, but it's something that we do 2.5 years later. As many of you know, in the beginning, we were doing this daily for both Clifton and Little Falls. And, you know, John and I talk about it sometimes, and we don't know how we kept up with it, you know, every day. But we knew that we had to be transparent, especially in those early phases. But basically, the press release was providing updates on new cases, any new deaths, prevention measures, isolation, quarantine guidance, and of course, any new updates on executive orders. So, like I said, we were doing this daily. Eventually, we reduced it to a few times a week, followed by once a week, then every other week, and now monthly. I know this is a hot topic for many people, so just allow me to explain the situation with the press release and the case updates. So initially, in addition to providing the press release, we were also providing a case information spreadsheet that listed the following information. So it would list the case number and when that case was reported, the individual's age, their gender, whether the patient was hospitalized, and whether they were a healthcare worker. It was more so early on, you know, at the start of this, we were seeing a lot of healthcare workers contract COVID-19, so we were interested in gathering that information. So in addition to that, in June of 2020, we started making follow-up phone calls to follow up on our, you know, existing cases to see how they were doing, you know, whether they recovered, whether they were experiencing effects of COVID-19, or if they were unreachable. All right, so unfortunately, towards the end of 2020, we were informed by the state through a directive that for municipalities with less than 15,000 residents, which applies to the Township of Little Falls, we could not provide specific, possibly identifying information like age, gender, et cetera. And this goes back to the data suppression rule that states that you're not able to share certain identifying information like date of birth, workplace information, et cetera. So unfortunately, we had to stop providing those updates. Today, what we do is we provide administration with a case breakdown, an age breakdown is what I meant, and then a weekly bar graph to look at the trends in the number of cases per week. So I just want to stress, while we want to be as transparent as possible, we have to respect the privacy of positive cases. I personally had instances where individuals were able to identify themselves on the spreadsheet and wanted to either correct information or clarify something. So it became a situation where, positive cases were probably, their privacy was at risk. So this is something that we had to, rethink.
I just want to mention about the number of cases. As we know, since the rapid test kits come out, there's a lot more cases than this, right? But a lot of times people do not call the health department and tell them that they're positive. So when we say for a while, it was really just the PCR testing. But now with the rapid testing, it's a lot more than this, I can tell you that much.
So this is an example of a line list. This is how we have been documenting positive cases that we have been receiving from businesses, schools, and daycares. We try to receive as much information as we can from the nurses in the schools, the administration, and the business owners. Then once we have the information gathered, we send this to the state and we communicate with them. And they let us know if the positive cases are declared an outbreak. They would be declared an outbreak if they're linked together. So for example, if the 3 or more cases share the same classroom, then this would be considered an outbreak. So we're always in communication with the nurses and administration in Little Falls, as well as the state.
So in December of 2020, we did start a COVID-19 hotline. The hotline was available for Little Falls and Clifton residents. The purpose of the hotline was just to be able to provide information to residents on anything related to COVID-19. So if they needed assistance with food, rental assistance, isolation, quarantine information, testing, vaccination, assistance, even finding transportation to a testing location, we would help make those referrals. As John said in the beginning, we had hundreds of calls every day. We got back to everybody as soon as we could. We assisted in making appointments for our clinics, and we continue to have this hotline now for anybody who needs it and would like to call. We don't get as many calls about, finding like a testing or vaccination site, but we do update that on a weekly basis, and we put that up on our website. We put it on social media, and we're more than happy to answer any questions if you're trying to find like the nearest location to you. We continue to do assistance with food, mental health resources, and we also do homebound. So we have done over approximately 24 doses in Little Falls of homebound vaccines, both first and second dose, and we continue as the requests come in to do homebound vaccinations for Little Falls residents for boosters, second boosters. These are just some pictures of our testing, of one of the testing locations. So we did do 2 testing locations at PV. Montclair also had a testing throughout the pandemic. They are not open at the moment for testing. But a good thing is that it was very difficult in the beginning to find sites, it was great that we were able to do the testing at PV, and also that Montclair had that open here. But now it's much more available, and we have the federal tests. We also have the state tests that are at home, and we have a bunch of them in the back if you'd like to grab any. And if you would like to get like a PCR and you want to find a location that maybe your insurance covers, because we know that, some of them are not covered by insurance anymore, you can definitely call our hotline and we can help you navigate and find testing locations that may be free at the moment. Okay. So we're just going to go over the isolation guidelines, how they were in the beginning of the pandemic and how they are now. So I'm just going to briefly discuss how it started. So in the beginning, you had to isolate for a full 10 days and be fever-free for at least 24 hours to end your isolation. Isolation began on, so the day that you tested positive was considered day 0. So then after that, you had to still isolate for an additional 10 days. It may be more if your symptoms were not improving. And again, if you were not fever-free for 24 hours. If you're asymptomatic, you also needed to isolate for the 10 full days, with day 0 being the date you tested positive. Today, things are a little bit different. You have to isolate. It's recommended that you isolate for 5 days, no matter your vaccination status. If after the 5 days you're feeling better, you're fever-free for at least 24 hours, then you can return to your normal activities, as long as you are masking for an additional 5 days. So it is still a total of 10 days. Just you can return after the first 5 days to normal activities. It is recommended that if you are immunocompromised, that you do the complete 10 days of isolation. And also if you are not able to wear a mask, like for example, if you're in a preschool and you're 2 or 3 years old and you can't wear a mask, it's still recommended that you isolate for the 10 full days.
And then these were the quarantine guidelines when the pandemic first started. If you were in known contact with somebody who was positive for COVID-19, you were told to stay home for the 14 days. And then if you were also a household contact, so always had constant contact with somebody in your household, you were to quarantine for during their isolation period, which was the 10 days, and then your isolation would start the day after their isolation would end. So you would quarantine for an additional 14 days. And now that has changed a little bit. So if you were exposed to somebody that was positive for COVID-19 and you're not up to date on your COVID-19 vaccinations, which we have a printout of the timeline of vaccination, including the boosters, then you should stay home and quarantine for 5 days and monitor for symptoms. And if you can, get tested at least 5 days after exposure. And then if you're symptom-free, you can end your quarantine, but still wear a mask around others for an additional 5 days.
We're stuck.
Well, we're stuck.
I think we're stuck, Mayor.
There you go.
Thank you.
So,
Everything. You're good.
okay. As of August 9th, 2022, the Clifton Health Department has administered a total of 17,542 doses of the COVID-19 vaccine. We continue to have clinics every other Wednesday at this point at the Clifton Health Department. And that is with an appointment or without an appointment. You can give us a call. We can make the appointment for you, or you can just walk in. And that is from 9 to 11. We also update that every week on our website, and we put up, if we're having a clinic or if we're not, we put that on our social media as well, and we send it out via email. Just to discuss a little bit the vaccination setup, there were 5 different stations when we were at the Clifton High School. So we had pre-registration, which is where the forms are given out to anyone who came in to get vaccinated. We had registration, where we double checked the paperwork and we made sure that whoever was there actually qualified for the vaccine at the moment. Vaccination is where our nurses were administering the vaccine. And then observation, you were observed in your car. It was a drive-through clinic. So you were observed in your car either for 15 minutes or 30 minutes if you had an allergy. And then inside of the Clifton High School, we had a team who was doing data entry, and they were inputting everything into NJIS. So all of your doses and ensuring that all of your information was correct.
And then these are just some flyers of the some of the vaccination clinics that we have. And there's a picture of when we had the vaccination clinic at the Little Falls Farmers Market. And then here's some more pictures at the mass vaccination site. And then at the Passaic Valley when we had the vaccinations there as well.
So we just want to talk again about the homebound vaccination. So if anybody knows anyone who is looking for their first, second booster in Little Falls, we can definitely make them an appointment. We will fill out the forms with them over the phone and just bring them over to be reviewed at the appointment. We do that as as needed. So if anybody knows anyone who may benefit from this, please have them give us a call and we're more than happy to make them an appointment.
Okay, so now Patrick Anderson, our epidemiologist for the county, will be going over his slide.
Good evening, everyone. My name is Patrick Anderson. I'm the epidemiologist from Passaic County Department of Health Services. It's great to be with you this evening and provide some recent updates regarding the COVID-19 pandemic. So on the left, we have the epidemic curve for Little Falls, where we could note case trends more acutely in the last 2 months. The general trend has been rather consistent with some dips and peaks. With the end of June, we're displaying the greatest number of cases reported in a single day at 9, with some days did report 0. On the right is the COVID-19 epidemic curve for Little Falls over the course of the entire pandemic. And we can certainly see some seasonal trends here. The highly virulent Omicron variant this past winter resulted in a great number of reported cases throughout the pandemic. But it's important to remember that that's when we had testing capacity. And we were able to accommodate all those requests as compared to earlier in the pandemic. And after this period, we did see the elevated case reporting attributed to a number of factors, notwithstanding the valorous and impactful public health measures we practice, which without could have been a much worse result.
Go down.
Maybe we have to, not getting it. Mayor's gonna do it.
Okay, perfect. There we go. So a similar trend is noted for Passaic County in the same interval with dips and peaks and the seasonal factors with the general COVID-19 epidemic over the course of 2.5 years. So it's very similar to what we saw for Little Falls for the greater county. So here I provide a distribution of COVID cases by age and gender for Little Falls. When the distribution is examined, it's noted that the 45 to 64-year-old population consists of the largest share of cases, with the 65 and older and 0 to 17 population comprising the 2 lowest reported population groups. And while we don't want to see any cases at all, it's encouraging to see that our vulnerable populations, the 0 to 17, the youth, and the 65 and older, the seniors, comprise the lowest sub-segments of the pandemic in Little Falls. And you can see that 52.7% of cases were females and 47.2% of cases were males. So Little Falls has a total mortality count of 23 and 1 case of MIS or multi-system inflammatory syndrome in children has been identified in Little Falls. In contrast, Passaic County has a confirmed COVID mortality count of 2,165. 9,349 individuals have been hospitalized over the course of the pandemic in Passaic County, and 22 children were diagnosed with MIS-C. On this slide, I displayed the cases of COVID-19 by race and ethnicity. So 63.6% of cases self-reported as white, 28.5% reported as other and unknown, 4% as Asian, 2.4% Black or African American, 1.3% American Indian, and 0.1% Native American. On the right, you could note the cases by ethnicity. So 64% reported as non-Hispanic or non-Latino, 20% reported as other, and 16% reported as Hispanic or Latino. So the Omicron variant was first detected in November 2021 in Botswana, and shortly after was seen in South Africa. It originally had the designation of B11529, and it's believed to be more transmissible than prior variants. However, vaccines do appear to be doing a good job at standing up to the Omicron variant by preventing severe illness and death. Evidence continues to suggest that it spreads more easily than other variants, In general, there are less symptoms, but the magnitude is not decreased for all, especially the immunocompromised population. New Jersey and Passaic County are doing well in the Omicron variant fight as compared to other states. The caseload increase, thankfully, has not translated into high hospitalization rates or a sizable increase in ventilator usage, which are metrics that I closely follow statewide. The state and county's high primary vaccine rate likely explains this protection and remains the best measure to protect individuals from COVID and from having severe illness and death, emphasizing the importance of both starting the primary series and getting boosted. So in Little Falls, if you go back one slide, please. So in Little Falls, 5 specimens were sequenced, reported to be BA1, 15, which is a subset of the Omicron variant. 15 were reported to be BA2, 6 BA212.1, 1 BA2.3, and 3 BA5. And these are figures as of mid last week. I'm sorry, one more time on the back. So the graph on the right shows the variants monitored in New Jersey over the course of the pandemic. And as the size of the color gets bigger, the variant that color represents becomes more dominant. A more recent report was released today, and the recent report lists the weeks July 17th through July 23rd, 2022. And it displays 80.9% of the specimen sequence being BA5, 8.9% specimens were BA4, 3.9% BA4.6, and 3.9% BA2.12.1. Next slide, please. Okay, so the next 3 graphs will display the COVID-19 vaccine uptake for Little Falls and the greater county by age group. So I know it's a bit small to see here, but in Little Falls, the recently approved 6-month to 4-year-old vaccines is broken up into 2 segments. The 6 months to 2-year-olds, it's listed as under 10%, and 3 to 4 years olds also listed as less than 10%. For 5 to 11-year-olds, it is 36%. 12 to 17-year-olds, it is 61%. 18 to 29-year-olds is 42%. 30 to 49-year-olds is listed as 70%. 50 to 64, 68%. 65 to 79, 89%, and 80 and older, 90%. And the numbers on the right represent the number unvaccinated in those subgroups. And I'm concerned about the 18 to 29-year-old population has been risen to NJDOH for Little Falls. The census has been cited as the reason for the seemingly low vaccine uptake. I did ask Montclair State University for a count of students that reside in Little Falls, as some dormitories are in Little Falls. And the count that I got was 3,935 when all dorms are occupied. So my guess that this likely impacted the numbers, artificially reflecting a lower rate for Little Falls in this age group. And when they got vaccinated, they may have reported their home address and not their Little Falls address. But I've been told that the census count cannot be changed and is often modified on college campuses, especially during elections when push for registration happens on campuses. But these circumstances probably is affecting that subgroup. Okay, so second boosters have not been reported yet from the State Department of Health. However, for first boosters, the eligible population for Little Falls is 7,684. And of that 7,684, 4,232 have received their first booster, which translates to 55%. So Little Falls is on the higher end of the county. In terms of percentage and the gap unvaccinated, we have the booster dose chart here listed. So for boosters, for the 5 to 11-year-olds, it is under 10%. And it's important to remember that for the under 5 population, boosters have not yet been authorized, so they're not reflected in these figures. Okay, so for the 12 to 15-year-olds, it's 29%, 16 to 17-year-olds, 31%, 18 to 29-year-olds, 43%, 30 to 49-year-olds, 50%, 57 or 50 to 64-year-olds, 57%, 65 to 79-year-olds, 77%, and 80 and older, 71%. And of these boosted groups, the largest share of unvaccinated, or where the largest gap is among the 30 to 49-year-olds, or 1,104 individuals. Okay, so again, I'd like to thank you for listening to the COVID segment of the presentation and wish you all good health.
So we're going to discuss monkeypox a bit. Before we start, I do just want to just make a point that the information that we're providing today, it may change. We're just going to give the most updated guidance that we have at the moment. But, if anything does change, we will continue to keep everyone updated.
Actually, you said that 23. So can you tell me where it's 23? When did the additional 5 people live off?
I believe your numbers also said 23.
No, we reported 23.
I did say 23. Mhm.
So with the CDRSS system, sometimes they don't come through in a timely manner. Or if we're not looking at that per se, I don't know, Leila, if you want to.
Yeah, so we did run a report. So you are correct. Our last press release reported 18 deaths. We recently ran a report where we found that many of the cases that we closed, there were an additional 5 deaths that occurred after the fact. We don't know this information. It's not often reported to us unless we run those reports. So I believe earlier on in the presentation, we did report 23 deaths, and I believe Patrick just reported 23 deaths. Of course, yeah. But
And I could tell you what the number of cases, and I know the mayor and I had so many conversations, and I had conversations with Dr. Gungel about in CDRSS, the number of cases sometimes that we would put out were different from the CDRSS numbers and the county would put out. So what we were doing is sometimes there was duplicate cases from the CDRSS system. So we had to go in and go through that
clean
information,
it up.
and
Yeah.
we would take out, because there's 2 results from 1 person. So we had to clean that data up, and that's why we were looking at lower numbers than, some of the numbers that were coming out from CDRSS. So, and I always said the numbers it's very difficult to match up sometimes, but that's the reason why.
And I mean, in the past, we've always tried to clean up our data, making sure that we account for any transfers. So individuals who actually don't reside in Clifton or Little Falls. And as John said, the duplicates were, they accounted for a lot of the discrepancies that we saw. I had one individual who I found in the system 8 times, and they were counted as a case 8 times. So
Right, especially early on,
Yeah.
labs, really, they were dealing with such volumes that they never dealt with before.
right.
So it was the laboratories that had to put that information. And some labs didn't even put the information in. For a fact, we know that people would call us saying, I'm positive, no one called me, and we didn't have any records of it. So the labs, again, I'm not blaming them, but I guess I'm blaming them. That information wasn't there, so.
If I could also add, sometimes deaths are not reported in live time, so it could be a backlog from weeks or months ago, and that requires quick investigation, and sometimes that's removed. Sometimes the address listed on a record where that decedent listed in the hospital, for instance, may not actually be where they live. They could be a transient person, so it could be case by case, and it usually requires follow-up and close attention.
And then there were some issues with individuals going to a nursing home, from a hospital to a nursing home. They would pass away, say in Wayne, and that even though they were a Little Falls resident, it would be counted as a Wayne resident. So there's a lot of still, I think, some issues with that. So it's not a perfect science, I could tell you.
Right, correct. I believe one of those deaths was recent. The other had taken place in 2020 and 2021 that were just never reported to us. Right. No, I mean,
Right.
it's,
Like I said, go back to the case numbers, they're not accurate,
yeah, I mean,
so.
it's a valid question, but there's a lot that goes into it.
I don't know if we could do that. I mean, we could probably do that on our end, but I don't know if we could do that and put that out to you. I would have to find that. I really wanted to finish monkeypox, but I don't know. Or unless you want to answer, it doesn't matter to me. Want to answer? Go ahead. I'm sorry. No, go ahead. Yeah, that's fine.
Say that you can no longer publish the gender and the age. And you went through it as it was codified for privacy. And where is that written? What citation are you using to censor that information?
I mean, we can go back and provide you with the directive, but the specific.
No, that's fine. I would
15,000.
really appreciate that.
Right.
I can leave
Yeah.
my email or my phone
Right.
number. Because it just doesn't sound right. That's not personally identifiable information.
Well, how we had it was that we were sort of assigning the case. We were indicating when that case was reported, whether that person was hospitalized, whether that person was a healthcare worker, in addition to the age and gender. So we still provide information on age and gender, but it's just more of a breakdown, kind of similar to what Patrick just presented.
Well, he's giving ages and gender too.
No, he is, but he's not listing, he's not assigning
Profession.
numbers to cases.
Profession. Well, would you please send me
Sure.
the information about that? And maybe we can have another dialogue about that.
Okay,
Because that's not private information at all.
we're just going by the directive that was
That's the
issued
one I need to see.
by the state.
Thank you.
Not a problem. I'm mean sometimes. Uh-oh.
Okay, so we're just going to continue with monkeypox. So just a little background information on monkeypox. It is a virus that is part of the same family of viruses as the variola virus, which is the virus that causes smallpox. So it was first discovered in 1958, but the first human case occurred in 1970. Prior to the current global public health emergency, monkeypox had been reported in several Central and Western African countries. So the symptoms of monkeypox can include a fever, a headache, muscle aches, backache, swollen lymph nodes, chills, exhaustion, respiratory symptoms like a sore throat, nasal congestion, or a cough. But a rash is what it really identifies it as monkeypox. So you would have, in order to test positive for monkeypox, the lesion would have to be tested. And other areas are also near the genitals, but it could also be on areas like your hands, feet, chest, your face, or your mouth. So these are just some examples of what monkeypox can look like.
So as of right now, the transmission for monkeypox for the public is currently low. It can spread to anybody through close personal, often skin to skin contact. It includes direct contact with monkeypox rash, scabs, or bodily fluids from a person with monkeypox, touching objects, fabrics such as bedding or towels that person has used that has monkeypox, and contact with respiratory droplets. This contact can happen during intimate contact, including oral, anal, and vaginal sex, or touching the genitals of a person with monkeypox, hugging or massaging and kissing, prolonged face-to-face contact, and also touching fabrics or objects during sex that have been used by a person with monkeypox and that have not been disinfected.
So just some, the monkeypox prevention. It's recommended that you avoid close skin contact with people who have a rash that looks like monkeypox. Do not touch the rash or scabs of a person with monkeypox. Do not kiss, hug, cuddle, or have sex with someone with monkeypox. Also avoid contact with objects and materials that a person with monkeypox has used. Do not share eating utensils or cups with a person with monkeypox. Also, do not handle or touch the bedding, towels, or clothing of a person with monkeypox. Also, wash your hands often with soap and water or use an alcohol-based hand sanitizer, especially before eating or touching your face or after using the bathroom. So if you are, I'm sorry?
In Little Falls, we have 0 cases. Clifton, we have 1. I don't know, Passaic
Okay.
County.
Sure, I could share. So we have, as of this morning, 15 total cases. And the range of age is 20 to 58.
So if you are exposed to monkeypox, you should isolate as soon as symptoms appear. Wear a well-fitted mask if you have to go out, especially when in prolonged close proximity with others. Avoid close contact, including sexual or intimate contact with anyone until you have been seen by a healthcare provider. If you start to notice lesions, contact your doctor or your local urgent care facility for testing. Rashes on the body should be covered with long sleeves or pants to avoid touching other people, and call your healthcare provider ahead of time.
So as of right now, this is the vaccine eligibility. People that are eligible to get the vaccination are people who have a known contact with someone who tested positive for monkeypox within the past 14 days. People who have attended an event where known monkeypox exposure occurred within the last 14 days. And people who identify as gay, bisexual, or men who have sex with men, and or transgender, gender nonconforming, or gender non-binary, and who have a history of multiple or anonymous sex partners within the past 14 days. And as of right now, the state of New Jersey is expecting additional doses and continuing to expand the access of this vaccination.
So these are some locations where you can get vaccinated. If you are high risk, or if you've been in a setting where monkeypox, there is a confirmed monkeypox case, you can go to one of these locations.
And then on this slide right here is with the Passaic County Health Department, and this is where you can get your monkeypox vaccination.
And if I could just jump in real quick, we're going to post this on our township website within the next day or two for any residents that may be watching and have interest in reviewing the slides or getting this information in greater detail or trying to write anything down. We will share this on the township website so everyone will have access to it.
And we also post this on our social media. We have Facebook and Instagram, so you can also find it on there as well.
And we have also brought copies. So in the back table, there's copies of these clinics.
So I figure we ended on a lighter note. Our lantern flies. Has anybody seen lantern flies in Little Falls? They're coming, believe me. That's one thing I could tell you, they're coming. They're starting to come up this way. And so basically there's really not too much you can do other than kill them. Or you can also call the New Jersey Spotted Lanternfly hotline at 1-833-422-3284. Can't believe it's giving out hotlines for that. But so yeah, that's out there too. So I guess, Mr. Scherz, I know you had a few questions that you sent, so I hope most of them were addressed during the presentation. I know a few weren't. One of your questions was regarding HVAC systems in the community. We do not, as a health department, go out to do any type of inspections on HVAC systems. That's not our expertise.
I was extraordinarily impressed with the amount of work that a very small health department has done. I don't know. Very well. With regard to the HVAC
Mr. Scherzer, will you come to the microphone so everyone at home can hear you as well?
Patrick, who I met with, presented some data on vaccination levels. What was striking about your data was the very poor vaccination rates, fully vaccination rates among school-aged children. And yet schools are about to open again. We're in the third year of a pandemic, and we're unaware of the efficacy of the HVAC systems in our school buildings and other public buildings. And I want to suggest, this is not an argument with the Clifton Health Department. I think that this is a much bigger question in terms of resources. That's the most serious problem that we have going forward with regard to COVID. We can focus on masking, CDC, and by the way, you know I have a CDC background. I go to a meeting every other week with about 45 CDC colleagues. And the vaccination levels, the public fatigue and what have you, are not getting much better. And when you start looking at these younger age groups, that many of which just became eligible for vaccinations, they're very poorly vaccinated. And I pity the school systems that have to try to separate kids, from whether in the bathroom or what have you, to keep them socially distanced. And you know that CDC, God help us, just came up with a recommendation that said we don't have to do this, the same amount of distancing as we've done in the past. But the one thing that we can control is we know that this virus, we know that COVID is an airborne virus. We know how it's spread. And we know that there are engineering levels, CDC has them as well, where you can define whether or not an HVAC system is working sufficiently to filter the virus from the air. And what's great about that is you don't have to depend upon anybody's behavior. It's just something that's built into the environment. And I'm terribly concerned that we are unaware and don't rate. When a parent sends a child to school, we ought to have a rating system that says, here's the status of your system. And we all know, unfortunately, that many of our public buildings and many of our school buildings have systems that were built many, many years ago, and they're simply not adequate. So this is not an argument or a criticism of Clifton or Little Falls or anybody else, but it's a statement that if we really want to protect our children, and through our children protect our families, that we need to do something about the HVAC system. And I want to make one other comment, and I'll promise to sit down. And when I met with Patrick not too long ago, one of the things that concerns me is that we have politically based data systems. We count Little Falls, then we count Woodland Park, then we count Totowa, 3 different health departments. Then we count Montclair University, and we still can't get straight the 3,000 kids, whose data system they're in and they're not in, and what have you. We have a regional high school in Little Falls, and we need to have a data system that collects data from all 3 of these towns as a disease entity, as an epidemiologic entity, so that we can evaluate what's going on within a community. When kids walk out of Passaic Valley High School and they walk across the street to the bagel shop and they're carrying a virus, they don't have a sign that says Woodland Park or Totowa or what have you. And you guys are in Clifton. So something needs to be done in terms of the system. And now I know I'm going to piss the mayor off. I don't think you guys have enough money. I don't think we have enough resources that are going into public health in order to get all these things done.
But I think that's at a higher level than us. I think our resources,
We can speak to a higher level.
well, I think that's right. We do need to speak to a higher level because there's never, and as you know, you're a CDC, right? So there's never enough money for public health.
I understand, but we ought to have a responsibility to issue a report.
But what about when the children, whoever goes to Willowbrook, right? So now you expand that. It's difficult. And we have the county health department, we have the epidemiologist that does monitor different, I don't know, Dr. Gungil, if you want to say anything, I don't want to put you on the spot or Patrick, but I feel that the system is working okay. Can it be improved? I think so, but I don't think having, and this is just my opinion, one health department is going to make a difference, because if we do see any type of trends, I don't think you're going to see a spike in Little Falls and not in Totowa and Woodland Park. I don't know. Am I missing that?
Thank you. Good evening, everyone. My name is Charlene Gungil. I'm the county health officer. I almost said epidemiologist. I used to be. So to comment on your Passaic Valley High School students who are from 3 sending municipalities. If there is an outbreak there, Patrick could actually link the cases together so we could know that that outbreak is affecting kids from 3 different municipalities. So when we look at an outbreak, we look at all the people, and within CDRSS, you can go in and click on something which allows the nurses to see what's going on within the high school. We have that capability right now, and we do it routinely. For your other point, you're absolutely right. Public health is never funded well. No one thinks about health until they lose it. So we're always in the market looking for opportunities. We're always looking for grants. And, you know, John is right. This has to go further up. We don't have control over how finances are allocated to us. Thank you.
So let me just end by saying, we can at least ask each public school in this area to submit an up-to-date environmental engineering report, not very expensive, that defines the state of their HVAC system. And we can at least comment on whether or not that state of that system is sufficient to protect the children and the staff in those schools. Whether that's Clifton's responsibility or the county's responsibility, the state's responsibility, that's one thing that we can do. I want to make one other comment. If we're going to deal with monkeypox, one of the dilemmas that we have, I was in New York City, I was Assistant Commissioner of Health when we looked at a phenomenon called HIV/AIDS, and we were trying to figure out what the hell was going on. And one of the difficulties that we have right now is, it's one thing to say, monkeypox is primarily a disease that is transmitted through sex between men. And that bestows upon us a really difficult task, very sensitive task of working with the community. It's one thing to say, look, you go get a vaccine. If a kid if three boys in a high school decide, well, we're going to go get monkeypox vaccine, what they're saying is we're gay. And we have to be very sensitive about how we're dealing with that kind of situation. But I want to leave with where I start. I would rather be in a room with public health people than any other group in the world. I think you guys are doing a fantastic job. I think you're doing a fantastic job, but I think there's a lot more that needs to be done. And if you take nothing else away from what I said today, is evaluate the HVAC systems in our school buildings. Thank you.
Thank you. Does anybody else have any questions? Anybody on Zoom?
On Zoom.
I see no hands raised on Zoom.
You know, if there's no questions, I mean, we could, if you don't want to talk in public, we could meet in the back if you want. I am here, not outside, but me in the back. All right. So I what was
Hold
that?
on. There's 4 comments in the chat box, I believe.
Oh, those were all addressed. The question.
Oh,
was
they're already
if the-
addressed. Okay.
If this would be posted
great.
on,
Yeah, we could send you
We'll
the,
definitely
on
send
the
you this one.
website, and they asked for, they couldn't hear the comments,
you.
and that's why I asked Mr. Scherzer to
Okay.
come to the microphone.
okay. Again, thank you for coming out.
Thank
I
you.
really appreciate everyone's interest and, thank you. Be safe. Okay, and let's have a good year.
Huge thank you to the Health Department, both in Clifton and Passaic County, for all of your assistance. Yes, certainly a round of applause for everything that you've done the past several years. And I want to thank the council for all of their support that they've always shown to the Clifton Health Department, as well as the county health department for all of your assistance. I
Thank you,
know
Mayor.
this is a battle that we are all in together, and I thank you all for the efforts that you've put in, as always here in Little Falls, but especially over these past 2.5 years where it's been particularly challenging. So thank you all, very much appreciated.
Thank you.
As I indicated, we'll get this information on the website for everyone to see. And again, just a final thank you to everyone that joined us here tonight. Everyone stay safe. Have a great night.